Hi, I'm Rob Stevens. I'm part of UCL's Perioperative Medicine programme. We've got a postgraduate certificate, a postgraduate diploma and a master's. Let's look at the content of these. So, the certificate involves getting all 4 modules done in 2 years. You then move on to modules 5 to 8, where you will obtain your postgraduate diploma. We'll talk about the master's later on. Let's look at these modules in detail. So module 1, setting the scene in perioperative care, where we talk about the sort of demographic challenges of surgical health in the current age. Module 2, we talk about inflammation, the inflammatory hit, and how we measure outcomes. Of course, all of us involved in perioperative medicine, or indeed any contemporary medicine, are concerned with how older patients fare. So Module 3 talks about older patients who are seeking surgery. Module 4 is our quality improvement or improvement science module with some leadership tools chucked in. So if you achieve all those 4 modules, you'll get a postgraduate certificate. This has to be taken in 2 years in total. Let's look at the other modules for the postgraduate diploma. So, Module 5 is about statistical tools. Of course, we have to understand or have a basic understanding of statistics to function in the modern medical world. Cardiovascular disease and fluids certainly are important tools that we use in the perioperative arena. And that's the subject of Module 6, including heart injury and heart failure, as well as goal-directed therapies. The cancer epidemic, clearly linked to aging, is the subject of Module 7, where we talk about and look at each different type of cancer and, of course, pain, a key determinant, a key outcome of how we're doing as perioperative physicians. Our last module in the diploma are a mixture of various topics, including how surgery evolved, surgery schools, the big conversation about end of life, informed consent and big data. So, if you're on the MSc program to do a master's, there are 2 options for what to do after you've finished your 8 modules. You could do a classic MSc written thesis of 9,000 to 12,000 words and a viva. Or you can do a small module which has 4 taught chapters in how to do a systematic review and then a shortened systematic review of about 5,000 words. So those are the 2 thesis options after your postgraduate diploma. The postgraduate certificate should be taken over 2 years, and then if you go on to take the postgraduate diploma and masters, these must be taken within 5 years of starting the whole course. Well, I hope that's helped explain what the postgraduate certificate, the diploma and the masters are. Please don't hesitate to get in touch via email and search UCL Periop MSc to see an example of our content.